There's 5 main things to think about when we're thinking about blood sugar spikes. The first is that a big acute blood sugar spike can actually lead to inflammation in the body, which we know is related to so many chronic diseases. Chronic inflammation is really a root cause of so many of the chronic diseases we're seeing today. So a big spike in the body says to the body, oh, something's a little off here. Our homeostasis is a little bit perturbed at the moment, and that's a threat signal. So the body will actually mobilize an inflammatory response to a large glucose spike. We don't want that day in and day out for the course of our lifetimes. And of course, the average American, day in and day out, is eating refined carbohydrates and sugars, and is on that blood sugar roller coaster. So inflammation is number 1. Number 2 is oxidative stress. So this is the generation of damaging metabolic byproducts called reactive oxygen species, which when they are out of balance, when the body can't handle how many of these reactive molecules are being generated, they can go around and damage the cell. They can damage fats and proteins and DNA and cell membranes and cause dysfunction in the body. So we don't want excess oxidative stress, and big swings in glucose basically drives more of these metabolic chemical reactions in the body and can generate more of these metabolic byproducts in excess. The third is glycation. So glycation is actually just when concentration of glucose in the blood is high, more glucose will stick to things. It will glycate things. So also it will glycate things like fats, proteins, DNA. And when you have sugar stuck to something, not ideal. And an example of this actually is wrinkles. Wrinkles are the result of glycation, in part because high sugar binds to collagen, one of the most abundant proteins in the entire body, which makes up a lot of our skin. And when sugar binds to the collagen, it glycates the collagen, and then the collagen basically forms cross-linking. And so it's a little bit more of a jumbled mess in the skin and contributes to wrinkles. The fourth problem is that a big blood sugar spike is often going to be followed by a big crash. And that process is called reactive hypoglycemia. And if you have a much more gentle rise after a meal, you're not going to see that big crash, because when the body gets a big blood sugar spike from a large carbohydrate-rich meal, the body responds by releasing this hormone called insulin from the pancreas. And that's the hormone that, of course, allows you to take blood sugar out of the bloodstream and into the cells. And if you have a really large blood sugar spike, you're going to have a large insulin surge. And that can sometimes overshoot in taking up glucose out of the bloodstream and lead to this dip after the meal that's actually lower than your pre-meal baseline. And that dip is often when people feel that anxiety, fatigue, needing that second cup of coffee, and more cravings. We've seen that in that reactive hypoglycemia moment, that's when people reach for more sugar, in part probably because they're trying to get their blood sugar back up. So we can avoid that by just keeping things more stable. And then the fifth thing that's really important to focus on is that these spikes over the long term are going to generate what's called insulin resistance. Because if you're constantly spiking your glucose and therefore spiking your insulin, the cells are overwhelmed with this insulin signal. And when cells in the body are overwhelmed by a chemical signal, they often will respond by down-regulating the ability to respond to that signal. So they'll make the receptors less sensitive to that signal to kind of protect the cell from all of this influx. So the cell is saying, you're driving so much sugar into me, my mitochondria, the energy factors of the cell that actually convert the glucose to energy, they're overwhelmed. Too much reactive oxygen species are being created. We need to block some of this entry into the cell. And that's called insulin resistance. But the body is like, no, we got to get this blood sugar out of the bloodstream. So it actually responds by surging way more insulin to drive the blood sugar into the cells. So you've got this kind of ratcheting up of more glucose spikes, more insulin resistance, more insulin being secreted, a process called hyperinsulinemia. And this insulin resistance is, of course, at the root of type 2 diabetes. But we also now are learning that insulin resistance is related to 9 of the 10 leading causes of death in the United States. Insulin resistance is a big deal. It's a big problem. And now most Americans have it because of the way that we're eating and living. So we want to stop constantly stimulating the body with these large swings in glucose to kind of take the gas off how much insulin we're having to secrete every day, give ourselves a little bit of a break from having to respond to all of this, keep them insulin sensitive. And the reason insulin resistance is so damaging is because aside from insulin having that effect of helping take glucose out of the bloodstream, it has dozens and dozens of other biologic effects. So when it goes up with hyperinsulinemia, it's having effects on the whole body. Some things that it does that we don't want. One, it is actually a fat storage hormone. It's an anabolic hormone. And you might wonder, well, why is that? Well, because fat and glucose are two of the main substrates for energy in the body. And if you've got tons of glucose coming in and the body understands that as a high insulin level, then it's going to say, oh, we don't need to use fat for energy because we've got so much glucose around right now. So it will stop fat burning and it will promote fat storage because you've got so much glucose. So for the 74% of American adults who are dealing with overweight or obesity, this is obviously very relevant. We don't want insulin levels to be high. The second thing is that because it's an anabolic pro-growth hormone, it can do things like stimulate the growth of cancers. So we don't want that. We don't want to be pushing growth all the time. It has effects on nearly every cell type in the body. So just another example, it stimulates the ovaries to make testosterone. So strangely enough, the leading cause of infertility in the country right now is polycystic ovarian syndrome. And the root cause of what's going on in this condition is that high insulin levels stimulate a cell type in the ovary called the theca cells to produce more testosterone and androgen hormones than it's supposed to. And that is really the root cause of why we see the fertility and menstrual irregularity issues and some of the other symptoms like excess hair growth and acne. And a last example, there are literally dozens of these of how it's a root cause of so many chronic diseases, but it also negatively impacts the ability of the body to synthesize a compound called nitric oxide, which is a key compound that helps dilate our blood vessels. So when your insulin is high, you're going to have more trouble dilating your blood vessels. And really, one of the foundations of health is, can we get blood to a tissue type? Like, we need to get blood to every single cell type so that it can actually do its work and have the oxygen it needs to do aerobic respiration, metabolism. And so we see so many diseases now that are an issue with cell types not getting enough blood sugar. Anything that's like a small vessel or a large vessel disease. So retinopathy, small vessels of the retina having problems. We see this in people with diabetes. Erectile dysfunction, the penis not getting enough blood. We see this in high rates in people with diabetes. Heart attack, stroke, two of the leading causes of death in the United States. Kidney disease, where the small vessels of the glomeruli in the kidney don't get enough blood. So anytime we're not making nitric oxide, which is directly related to excess insulin and insulin resistance, that's a problem. And so that fifth reason of insulin resistance is, aside from inflammation, glycation, oxidative stress, reactive hypoglycemia, and insulin resistance, this is really the reason why we do not want to be spiking our glucose all the time and putting this huge strain on our body. We want to stay as stable as possible as we can throughout our lifetime in terms of our glucose levels.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
If you are an American born today, you are on a direct trajectory towards having a blood sugar problem, having metabolic dysfunction, and having insulin resistance. And this will increase